So we are still in the month of October, where we always talk about breast cancer and mental health. We are still in the discussion of the depression in breast cancer. We have Dr. Anlima Abishai, who is a clinical psychologist at the Kolebu Teaching Hospital and also a consultant at the Brain and Sleep Medical Center. And then we have Dr. Barbara Bachman, Dr. Bibi, who is also a psychiatrist at the Kolebu Teaching Hospital as well and the Brain and Sleep Medical Center. On Zoom, we have Miss Juliet Mills-Lutrot, who is a survivor of breast cancer. She's also the CEO and the founder of Pink for Africa. She is a strong, industrious mother and everything. And she would like to share her experience on how she was able to go through the healing process, how she coped, and then how she is living with the treatment and everything. She's going to give us everything about how she went through and how she's been able to survive. I am still your host, Dr. Sue. Hello,
Hi.
my gentleman and my lady.
Hello.
So I'll still start with
Sure.
Miss Juliet. So Miss Juliet, how was the healing process?
There is the healing process from your biopsy, which is a small process. There's the healing process from your surgery. I had a mastectomy. That was an experience to go through because I was also going through reconstruction during that same time. After the mastectomy, they put expanders in, and the journey begins with that increase of fluid in the expanders to expand the skin, to then create the breast area, to prepare the breast area to receive the implant that goes into, to even you out. So I had a double surgery. I had one on the left and one on the right. The right one was to adjust the breast to fit into, to match the left. And the left was a full mastectomy. The healing is like any healing from surgery, you know. Your first few days coming out of surgery, it's going to be rough. You push through it, and each day it gets better and better and better, you know. So
Especially when you stay positive, as you
chemo
said.
started. Excuse me?
Especially when you stay positive, as you said earlier.
You know, I think that positive attitude is, I felt my chemo did its job because I was positive. That's how I thought. So I think it's important that you stay positive. And that is why I think we are thankful for the culture we have, that it is rooted in faith. Because your faith is also going to be part of your journey, is going to be what reminds you that God has a bigger and a better purpose for you. So you need to pray to him and ask him to bring the right doctors, the right nurses, the right support your way, so that you can, you know, live to tell your story and encourage others.
Right. Dr. Bachman, as a psychiatrist, what coping mechanism can you advise patient going through this journey to cope with or to have, so they can manage their treatment?
For coping mechanisms, it will be his field than mine. But to add to what Ms. Julia was saying, the spirituality complex, like if you build your treatments and your life on a supreme being, or have faith in something, it helps you have a positive outlook to any situation you are in, and then also aids your healing process. But for coping, I think he's better suited to answer that.
Yes, please.
With a very elongated response. Yes, I would compartmentalize it.
Okay.
So when it comes to the coping,
Right.
see, there are so many facets of dealing with breast cancer. So we have the cognitive coping, whereby you look at your thought processes, as Madam Juliet was talking about, where you have to stay positive. There is one school of thought in psychology that says that whom you are today is as a result of the thoughts, decisions, and choices you made or allowed to control you some time ago in your past. So choices that you are going to make are very, very, very key. Okay. They'll determine whether you'll be able to cope appropriately or not. You may even have to use an economic coping because it involves money to battle this. It's not free entirely. So you have to prioritize certain things and see how you can be able to raise money, get some support from friends and family so you can be able to battle this effectively. We have your lifestyle that comes to your physical coping, whereby the way you eat, the way you sleep, the kind of things you are going to choose, vegetables and fruits. Even not all fruits and vegetables are good for you. You have to be able to balance it and get some help from a dietitian. So all these things also come to play. Proper sleep, water, and all that. And we have
sleep what? Sleep, water.
Proper sleep, your drinking habits, water, they all play a very key role. So all these are ways we can cope effectively with the breast cancer during a particular phase.
Okay, so it means that we should keep a positive lifestyle and healthy lifestyle to be able to cope with. How about the support group, the families? How do they cope? How can you advise them still on the psychology?
Yes, there was a study that was done which shows that sometimes those who are caregivers caring for those with the disease, they end up becoming hidden patients themselves. And there are a number of times whereby they even lose their lives in the process. So while
sometimes there are people taking care of patients and then they rather pass even before.
So while you care for someone who is a victim, you also care for yourself as well. Now, when it comes to the families, we all have to help the victim because you help someone, they also help you too. So we have to see how we can allocate tasks. There is what we call emotional validation.
Okay.
Oftentimes, family members would like to tell the person, "Oh, be strong, be strong. You must have faith in God." It's very true. But there are times when validating their emotional experiences that, it's okay to feel sad. It's okay to be worried about the condition, but it will get better as you keep on. So once we are able to encourage them, validate their emotional experiences, it really helps them to be able to keep moving. So we support them physically, we support them emotionally, spiritually, in every way, so they can pass through the phase.
I think I want to add on to what he said. Okay. Also, for the caregivers, they have to educate themselves about the condition, because when you know more about it, you can offer better, you'll be a better person. Yes, to the person going through. So you should also try and get to know what the disease entails, the treatment processes at every stage. Inform yourself, so you're a better support system to the person who has been diagnosed.
So, as caregivers, we need to also educate ourselves. We need to read more about it so that we don't even think that cancer is infectious. Some people think that it's infectious.
Yes.
And so when they get closer, they might also get it. Yeah. So we have to learn more about it, read more about it. And the media space, what do you say about that? How we can also help people?
When it comes to the media, they can play a very great role. So the things we are going to show about it could even be a short documentary. It could even be a movie. It could be a podcast like we are doing today. So the media have a very key role to play. They can have some of the survivors, interview them, their experiences, get professionals. When we do so, we are
we are doing a good job, yeah.
Very well.
Okay.
We are able to enter into homes with this media role, homes where even door approach will not be able to reach. Because media is able to enter into people's bedrooms everywhere.
People's bathrooms everywhere. So what's this psychiatrist's role in the healing process of breast cancer?
So we will come in when there are mental health issues.
Okay.
And we are discussing depression. It can also be anxiety and other things, but we are
Okay.
discussing depression.
Depression.
So when the person is diagnosed,
So in general, there could be other mental health issues.
yes.
But
I think
today,
Mijila mentioned that she has some anxiety, but in the beginning when she was told of the
okay.
diagnosis, yes. So there are other things that can happen, but then we are focusing on the depression bit. So depression, I think we mentioned the previous episode that it's in sections. We have mild, moderate, severe.
Okay.
So for the mild, usually is psychotherapy. They come to see him and then they go through several sessions. And then for the moderate and severe, it's psychotherapy and medications. And the medication, don't just give any medication. We give one that doesn't interact with the cancer medications that they are having. And then for people who are suicidal, they have a special brackets of treatment that we give them.
So there are people who feel like committing suicide.
Yes.
At what point?
It can be from the diagnosis right through to like the treatment. The treatment can be very brutal. So at a point, somebody just says, enough is enough. I want to end it all. I don't want to go through all this anymore. Then they start having the suicidal thoughts. And for people like that, when they're identified, we have to treat them urgently because it's an emergency.
Doctor, neuropsychologist, right? Neuropsychologist. So what are their roles, or what is your role as a neuropsychologist in the breast cancer patient?
Yes, true healing begins from the mind, the mindset. So we work to be able to ensure that we are working with a person's cognitive framework so they are able to think positively and use positive coping approaches or mechanisms. In doing this, we use a non-medical approach.
Okay.
And in this non-medical approach, we work to ensure that this person is having the best joyous moment they can be able to have as they go through the phase. As mentioned in the previous episode, depression can limit our immune system from being able to work effectively. So if your immune system is limited in terms of its job, then chemotherapy, whatever you are doing, will not be able to function effectively. And that's where we come in.
So it means that your role is equally important as the
Psychiatrist.
and the psychiatrist as well.
Yes,
Okay.
yes.
So
You
Miss
work,
Juliet,
hand in hand,
you work
synergistically.
Yeah, okay. Miss Juliet, what's the role of advocacy in the patient who is going through breast cancer treatment?
Truthfully, when people are going through the journey, it's very difficult for them to talk and advocate about it. Very few people do. They want to complete the journey, feel victorious, and then they can talk about it confidently. But while they are going through it, majority of women don't even want their picture taken. They don't want to tell their story. They're not ready to really talk about it. But the advocacy to continue, it's been very difficult for me to hear what both doctors are saying. For some reason, the audio is not very clear on my end. So I cannot hear so much of what they're saying. But I think I heard something to the effect of cost.
Yeah.
A lot of people going through the journey, especially in Africa and in Ghana, sometimes will start their journey and stop because of financial reasons.
Right.
So, they've tapped into their immediate family, they've tapped into their church, they've tapped into all of the different people who can support them. I think this is where the NGOs that are out there should really be encouraged to raise money to kind of subsidize and come and support that. Because you don't want to start your treatment and stop halfway. You don't want to do that. I remember a doctor describing it as poking at a lion, and eventually when the lion gets out of the cage, it's going to come after you. So once you start, you want to complete that cycle of recommended treatment so that you can continue with you can continue with your healing process.
Right. I was actually going to ask you that how do people help? I mean, resources. What are the main ways of getting resources for this kind of activity? To go through it.
Okay. For the start, some of the few patients I've been able to work with, think the health insurance picks some sessions of the treatment they have to go through. In some cases, it might pick up to about the 18th section. Then beyond that, they have to start paying for themselves. It's very expensive, I must admit. Some are paying about 8,000 Ghana cedis per every section. Some are paying about 15,000 cedis per every section. This is very enormous. That's when it comes to the coping. Planning our finances is very key. And we will not be able to do it all alone.
Right.
So yes, health insurance would come in, and the NGOs also come in to also provide some form of support or cushion to be able to assist with the process.
So does NHIS support these treatments?
Yes, NHIS covers chemo.
Okay.
And then reviews as well, and the OPD consultation and chemo, it covers. But there's some medications that you use that is not covered, so you have to go and buy. But chemo is covered on NHIS. Yeah.
Does medical care and mental health work hand in hand?
In relation to the depression and
Yes,
breast
the depression,
cancer.
yeah.
Yes. I think in the previous episode, in the introduction, you mentioned that breast cancer has a medical component, has an emotional component. So the emotional part is where we come in. So on the wards, we have what we call liaison psychiatry, where you go to the different departments and then you are part of the team managing that patient. So that's where we implant ourselves, and then we review patients, and over there we're able to pick any mental conditions that the patient has earlier, so institute treatment. So we're also part of the oncology team, sort of, and we move with them in their treatment of the patients.
I think she also mentioned something called
psycho-oncology.
Yes.
Okay, so it means that, Miss Juliet, we've upgraded. We have psycho-oncology also in
Probably
Ghana.
not the term psycho-oncology, but we have something
Similar. Right.
I think usually we use the term MDT, that is multidisciplinary team.
Yeah.
Where we have an oncologist, a clinical psychologist, or maybe a psychiatrist. And
Miss Juliet, are you with us?
Yes, I am.
Okay, so
I am listening to your upgrade.
Right. So it means that they work hand in hand,
Yes.
and so it's a whole team, right? Okay. So does anybody, could any patient be left out? Maybe finances, or maybe some background characteristics that may take the person out of this opportunity?
Well, for these services is offered in where I work, Kolebu. I don't know.
It's a public hospital.
Yes, I don't know whether other hospitals have that.
Hospitals have
The Langsity will have a psychiatrist on their team. At least when they have issues, they come and talk to us. So for Kolebu, I can say that when the primary care physician recognizes any mental illness, they refer to us, and then we go and see and then manage accordingly.
And you?
Yes. So when it comes to the care and supports, it works at different angles. So some would tap into their own finances. There are those who go to their family. Then we have the level of the church or the religious organization where they also come in. We have NGOs also coming in to support. There is a NHIS also coming in. Some forms of insurance that works in Ghana, health insurance also covers some of these treatments. And there are those who also fall on support groups, like Madam Miss Juliet and the Pink for Africa. So these support groups come in to also support each other in various ways, not just in terms of money, and it helps a lot. So no one should be left out.
Great. No one should be left out. Miss Juliet, can you tell us more about Pink for Africa? How you support the people with breast cancer, and how we can work hand in hand with you people?
So the hand in hand part I love, because everybody needs to, when they say it takes a village, it truly takes the entire village to be a part of this. The doctors can do so much, the nurses can do so much, the advocacy can do so much, but all of us together, I think that we need to create that. So for me, I'm always about solutions. Where do we go from here? How can we make it better? Okay, I hear the problem. What can we do to move to the next step? And I think that for us as Pink for Africa, we've stepped up our donors game. This year we raised double the amount we raise every year. Even though America is going through a financial difficulty, I really pressed upon the fact that if America is struggling, I can only imagine what the rest of the world is doing, especially Africa. So I knew that we needed to do more and support more. So with 2 hospitals now, we donate on a monthly basis. So we have navigators in each hospital, and they find the women who cannot afford or can partially afford, and then we step in and we continue. So every October, we give a token just for photo op. We go to the 7 hospitals and donate, and to be able to take pictures to show the donors what we are doing. But on a monthly basis, we show up in the 2 bigger hospitals, Okomfo-Anokye, Korle Bu. Actually, no, we don't do Okomfo-Anokye. We do Korle Bu and Tamale, and we just added Ho to it. So we're doing 3 hospitals now where they come to us on a monthly basis. Sometimes it's 2 patients, sometimes it's 5, and we support them. There was a young girl, for example, that we needed attention on right away, and Korle Bu was too busy with patients. So we convinced her to move to Ho, because the hospital, the oncology department in Ho, had room to take her. And we've been able to get through her treatment, her chemo, her radiation, and her surgery. So I think it is important for us to also work hand in hand with hospitals, and for them to know that, yes, the government helps to a point, but individually we all have to play a role in moving this forward. But we raise money. All of the businesses I own pour a percentage into Pink for Africa, because I feel before I can ask you for money, I need to tell you what I have done to support. Exactly. So I'm able to confidently say that I, through my businesses, donate 20% of our profits to Pink for Africa. And then personally, when I fly to Ghana, nobody pays my ticket. I do. When I rent a car to run around and do I pay for it myself. So there are certain things. Our focus is that the donations, 100% of the donations can go towards the cause and help a patient. So this year, for example, we're bringing in 500 prostheses. And we're donating. These prostheses are between $200 and $250, sometimes $275 a piece. So we're bringing it in to see how best we can also make a woman feel better after her surgery. I know what that feels like, because I am full, I'm complete, because I had reconstruction. But majority of my women in Ghana don't have that privilege. So a small way to say, listen, we see you and we want you to feel good about yourself. And that then ties into the mental health. So statistics, I read a few years ago that in America, years ago, they were doing mastectomies and not doing reconstructive surgery. The women, majority of the women had depressive behaviors, versus that when they started to do the reconstructive surgery, how confident the women started to feel. So it is a vital part of making us feel complete. I'm writing a book on it as I speak, about when a young girl gets her breast, and that journey all the way, when a man touches it for the first time, how that makes her feel. When she's an adult and she explores her sexuality, how that makes her feel. And then when she moves on to have children and she's able to now breastfeed her children, and how that makes her feel. So this journey, then one day you wake up and the doctor tells you have to take them off. They're going to kill you. So there's a divorce process you have to do with these things that have validated your beauty and your sexuality for so long. And now you have to say goodbye. So it's really interesting that it is such a personal...
Are you using your experience or other people's experience? Or what?
I'm using both. I'm writing about both. About my own experience as a teenage girl, and even conversations of having with, I remember my girlfriend telling me, go home and take the bankuta and hit your breast 4 times. It will come, your breast will grow quicker. And I woke up every day at 4 a.m. and I hit my breast to make sure that I was getting breast. So there is this notion of being a woman, being a complete woman with your breast. So, psychologically, it plays a role, but at the end of the day, you're not defined by your breast. Let's not make it about breast. I think you're defined by the spirit and the kindness and the goodness of the human being that you are. That is who your husband married.
So we are with Dr. Anlima Abishai and Dr. Barbara Bachman, Dr. Bibi, and Miss Juliet Mills Lutrot, who is a survivor of breast cancer, and she's told us about her experiences. And Dr. Bibi, who is a psychiatrist, has also mentioned a few professional help that we can get, and our clinical psychologist here, or our neuropsychologist, right, has also told us from the psychology perspective. So, there is hope. I always say that early treatment, early detection is the best, and it saves life. Go on a quick break, and then when we come back, they'll give us their final words. Don't go anywhere.
Welcome to the Brain and Sleep Medical Center, a haven for mental wellness, emotional well-being, and healthy sleep. Our peaceful environment fosters healing and renewal. Proudly serve institutions such as the Bank of Ghana, Ghana Ports and Harbours Authority, and the Judicial Service. We also consult at IMA, Duracare, and partner with the Trust Hospital. We manage sleep disorders through our state-of-the-art sleep lab, provide mental health care.
Greetings to all. My name is Dr. Yan Fojo. I'm the CEO and the founder of the Brain and Sleep Medical Center, currently located at Akoko. We started our journey from Community 10 in Tema about 14 years ago, and since then we have grown exponentially, covering all aspects of mental health.
In partnership with organizations like Pink for Africa, I am Patience Asamoah, the General Manager at the Brain and Sleep Medical Center. We are committed to excellence in both care and service. Our multidisciplinary team works around the clock to ensure every client receives personalized support, whether it's for mental health, sleep therapy, or addiction recovery. For help anytime, call our 247 crisis.
TBSMC, the premier private mental health and sleep medicine facility in Ghana.
Welcome back. You are watching Depression in Breast Cancer with Dr. Barbara Bachman, Dr. Anlisa Abishai, who is not shy, and then Miss Juliet Mills Lutrot, and your host, Dr. Sue. We are here discussing depression in breast cancer, the pathway to healing. How are we going to, what are the steps, what are the coping mechanisms that we can use in the healing process? And she has survived it. She was diagnosed about 17 years ago, and she is still working active, strong, and she has shared her experience. Miss Juliet, what are your final words for our viewers on depression and breast cancer? And the way to go.
First of all, thank you for having me. It's been a pleasure. I just want to tell all of you, depression is real. It affects so many of us in so many different ways, and breast cancer is no different. So please surround yourself with people who love you. Trust your doctors and your nurses. Know that they are here to make you healthy. They are here to serve you. and take better care of yourself, just all around, not mentally, physically. Exercise, eat well, be conscious of what goes into your body, and know that your livelihood is important because it impacts others in the society we live in. Thank you.
Know that your livelihood is important. That is the final word from Miss Juliet Mills-Lutrod, who is the founder and the CEO of Pink for Africa. In collaboration with the Brain and Sleep Medical Center, we are bringing you depression in breast cancer. Your final words, Dr. Bibi?
Okay, so I would say in summary that depression is real.
Right.
It exists and it's a part of us. And depression in breast cancer is also not a new thing. So if you have been diagnosed of breast cancer and you start having feelings of sadness that you cannot shake off, don't be shy to seek help. We're always available to give you the help you need, to help you in the recovery process as well. So always seek help and take care of yourself.
Life is good. Take good care of yourself. Dr. Bibi is telling us that we should live our lives, right?
Yes.
So take good care of yourself. Seek professional help when you see any changes in your body. Dr. Anlima Abishai.
Yes, it's been a very heartwarming moment being with all of you. We've come to appreciate the fact that breast cancer doesn't just affect the physical body, it also has a mental health correlation. And when depression comes in, it could even limit the function of the immune system. So survivors, please don't keep quiet, speak up. Because your voice might be the hope someone needs to be able to seek help and assistance. Together we can be able to fight this battle. And perhaps a time will come where breast cancer will be a thing of the past. To family members or caregivers, sometimes what your relative might need might be just your presence and your understanding and you being patient with them. Sometimes this level of you coming and being in their shoes, and the gift you can be able to give them. Healthcare professionals, we can also work hard among ourselves by not just treating the disease, but treating the person in his wholeness. I believe when we all come together and we advocate to help them, together we will be able to help ladies, help gentlemen who might be able to go through it and make this one a better place to live.
Thank you, my lovely panelists, Miss Juliet Mills-Lutrod, Dr. Barbara Bachman, and Dr. Anlima Abishai. Thank you. It's been awesome having you. Thank you so much. I think all that you're saying is that don't stay in your room and be depressed. Step out, seek professional help, and when you are diagnosed, there is hope. I mean, go in for all the things that has been discussed, and also take advantage of the October, the free breast screening, take advantage of it. At least visit a health facility, and then they'll give you a free breast screening. Please don't stay at home if you're a woman. If you have breast, kindly try and do something this October for yourself as a free gift. And again, I would say thank you to Pink for Africa Foundation and also the Brain and Sleep Medical Center for having this program. I'm thanking myself as well. Your host, Dr. Sue. I'm here with you all the time. Stay blessed and stay positive all the time. Bye.